So this is a dorsal device. On the dorsal device, we have a push device. We're going to advance these slides from the top, really in the direction of the arrow. You can see this side, really the arrow's pointing up. This side's the arrow's pointing down, so you have to pay close attention. But as we move these forward, this mechanism forward, it's going to push the fin and the lower jaw forward. What I don't like about the dorsal device is we have no lateral movement. So a patient that bruxes or grinds their teeth, this isn't always the best device to use. Otherwise, let's talk about the advancement. So again, I said I want to go in the direction of the arrow. On the right side, the arrow is pointing down. So there is a hole towards the top here. Let's call it the 12 o'clock position. We put the the pin in the hole and go in the direction of the arrow. So if I go 1, pull it out, 2, pull out, 3, 4, each time I'm pulling it out, 5, I've now moved this device a 0.5 millimeter. And as Christina moves up for a close-up, you could see this is 5 half turns or a full 0.5 millimeter forward. I've moved that forward. When I go to the other side, the arrow's pointing up, so it's easiest to turn this over. And now I'm just going to grab the device, and I'm going to take the device and I'm going to do the same thing again. I'm going to go into this top hole and I'm going to move towards the arrow. 1, 2, 3, 4, and 5. Each time, again, I'm taking the pin out because it ratchets. So now each side is a 0.5 millimeter distance away from the 0 point. And one caution I want to give to patients, as we advance this, I'm going to go back to the 0 point. So 1, 2, 3, 4, 5. I'm going against the arrow, but I want to show you, if I try to go further, I can't move it. If I force it, I am going to break this mechanism. So if you ever have to go back to the 0 point because you think you're off in counting, then please be careful. Once you get to that 0 point, you cannot move it anymore and will break this mechanism. Thank you.